Not your cup of tea. Nah. All right, well, it is what it is. You had another fight afterwards, I believe. Like J-Lo's ex or something like that. Yeah, I mean.
What's going on, YouTube? What's going on, YouTube? Let me go ahead and set up the music for y'all real quick for the people that's used to coming in and rocking with me while the music is cracking. Set that up for y'all right now. There we go. And we back. Oh yeah, we back. We back. We black. And we black. Cause we back. Oh yeah. We back. Let's get it. Ladies and gentlemen, my name is CJ Kyles, aka the High Value Nurse. If this is your first time here, I'm a licensed practical nurse. Went to school in 11 months, changed my life, put me in a whole new tax bracket. Primarily, this channel is about nursing, but we also dabble on other things here. If you are new, please hit that like button on your way in, and also subscribe to the channel, hit that notification bell, all that good stuff. Subscribe, leave a comment, share with your friends, family, all that good stuff. I greatly appreciate it. I will greatly appreciate it. Ladies and gentlemen, we are over here grinding as we normally do. As you know, I speak to you as if there are a million people in the audience. I don't care if it's one, two, none. I talk to you as if there are a million. So welcome to the show. I am very glad for you to be here this afternoon. Not really sure how long this will be, because tonight I am doing a different kind of show, something that's out of the norm for me. But I figure I want to dabble into some different things. Tonight, later on this evening, we're going to be talking about Chadwick Boseman and why Marvel needs to replace Chadwick Boseman's character. They need to recast the Black Panther character. We're going to be talking about that later on tonight. It's going to be a late show, though, probably around 10, 11, somewhere up in there. But I want to talk about nursing today. I want to talk about nursing this afternoon while I'm grinding, getting this paper. I do got a couple tests to study for. Well, I got one test to study for. One test left. One math test left, ladies and gentlemen. And your boy is pretty much solidified in the RN program. The good thing about this test, though, is that I don't have to pass the test, even though we are going to pass the test. But I don't have to pass the test in order to pass the class and still have a very good grade in the class, because I put in the work very early. I made sure that I was successful on the 4 previous tests beforehand. So this one, no pressure. I can just really chill out, still focus and stay disciplined on passing, but I can just really chill out. You dig what I'm saying? So there you have it. But ladies and gentlemen, I want to talk about it. You see the thumbnail, you see the title. Should healthcare professionals seek regular therapy or seek therapy on a regular basis? Should healthcare professionals seek therapy on a regular basis? Hold on. Because as you know, let me see. As you know, nurses have been going through it this past year. Healthcare professionals have been going through it this past year. Thank you so much, M. Mills. I appreciate that. Thank you. We've been going through it. Healthcare workers have been going through it. Doctors have been going through it. And that led me to the question, should we seek therapy on a regular basis? Now, I've said this several times before in the past. I used to think therapy was silly. I used to think it was nonsense. Um, I'm not gonna say I thought it was nonsense, but I thought it was silly just for the fact that you're paying somebody to sit there and listen to your problems without any real vested interest. That's how I used to feel. But I've definitely had a change of heart, especially over the past year. I've seen what therapy can do for some people. I've seen what therapy how therapy can help some people. I've seen really positive attributes and a positive aftermath that therapy can bring to a person. So it's always a good thing. And I've definitely had a change of heart on therapy. So I had a conversation last night with three other people, and no, I think it was like six of us on there, and I had Nurse Roxy, King Gene, uh, Rodney. I had Nurse Rodney, and I had your priest on there and Teddy G, and we were just all talking about the situation that took place between the guy, the former CRNA, he's now dead, who killed his ex-wife, his ex-girlfriend, whom was pregnant, and the baby did not survive, and he killed himself. So we talked about that, and we did our best with trying to be objective in that situation. And for the record, nobody on that panel was justifying what he did. What he did was indeed horrible. It was heinous. It was evil. It was sick. Um, Especially with him killing a unborn child. You dig what I'm saying? That it was a sick thing. He should not have done it. It was a horrible, horrible thing that he did, and um, he shouldn't have done it. But we were trying to be objective. We were trying to look at things from a different angle, or what that brother could have possibly been going through. And we did. We explored some of those things. We definitely explored some of those things that he was going through, which could have contributed to him snapping as he did. You dig what I'm saying? So you can be a victim and hurt people. Victims hurt people all the time. Victims of crime hurt other people. You know the saying, hurt people hurt people. Well, that is a true thing. Hurt people do hurt people, because that is all some hurt people have experienced, was hurting people. All they know how to do is hurt people. So nobody was justifying. Nobody was taken up for a murderer. Nobody was doing that. But we were trying to explore different scenarios and different situations that may have contributed to this man snapping. So maybe we can help someone else who may feel like they're on the brink of destruction, self destruction. You feel me? So yeah, it was, we had a couple trolls in there last night talking about, you helping a murderer, or you taking up for a murderer, or you're justifying what he did. And nobody's justifying what he did, but we do have we do need to have this conversation. We have to have this conversation. People, especially in this time, it's a hard time to live in. You dig what I'm saying? It's a hard time to live in as a people right now. It's definitely a hard time to live in. Um, this whole pandemic situation has changed the trajectory of a lot of things, and people are doing things, and people are adapting to situations that are so far from the norm that people are having different results from the adaptation. You dig what I'm saying? Now, we also said that I personally felt like this man should not have gone from one relationship while fighting a custody battle, because the guy who killed himself and the other people, he was going through a 3-year custody battle, which was costing him hundreds of thousands of dollars. He was a CRNA working through this pandemic. He had filed some sort of report on, I believe, the University of Maryland Hospital because I think it was a wrongful firing suit or something like that because of a situation with him and the doctor, and I guess the doctor stashing drugs in his locker, trying to blame him. I don't know I don't remember all the facts and all the details, but this is real shit that people deal with, and you never know what it's gonna take. You never know. All it takes is one bad day. Seriously. You ever seen that? You ever seen that? And I know this is a cartoon or a comic book, but it's real shit. You ever seen the comic book movie, The Killing Joke? It's very good, very good movie. Um, I recommend if you know, like Marvel, DC, you go watch it. But it's called The Killing Joke, and it pretty much was a story about how the Joker became who he was, and a lot of that can be based off reality if you really want to put it in the context. So real quick, the Joker was a comedian. He was a struggling comedian whom had a pregnant wife, and he was trying to make ends meet, trying to work, or whatever the case may be. He had a supportive wife who was riding for him, who supported his dreams, who was trying to see him make it, and she happened to be with child. She was pregnant. And then all of a sudden, I guess he had got into some trouble with some mobsters, with some gangsters, and he had made some deals or whatever the case may be. Joker couldn't come through. I think he owed some money to a couple sharks and a couple mob bosses. He couldn't come through on the payments, and they ended up killing his wife and unborn child. And he snapped. You dig what I'm saying? So, I mean, like I said, I know that's fiction. I know it's not real, but I think that is definitely a direct representation of what goes on with some people in today's society. You never know what pushes people to the brink of self-destruction. You have to be careful. In the video um, that Mr. Black had posted before he went and did what he did, well, it was after the first killing that he did, and he said that stop playing with people. You stop playing with people. Stop lying on people, and that's real talk. Stop playing with people who not trying to play with you. At the end of the day, this is why I stay in my own lane, bro. Seriously. I don't beef with cats. I don't do none of that stuff, bro. Because at the end of the day, it's not worth it. That is the one thing that I can say that I really truly respect about Kevin Samuels. Because dude, niggas be making videos about him, saying all kind of disrespectful things, and dudes say I refuse to beef. It's not worth it. And I feel him on that. It's not worth it. Somebody say something about me, I'm Gucci, bro. I'm living good over here. I don't care. I don't care, bro. It's not worth it, man. For real, for real. You know, I'm good, bro. I don't care about that type of shit, man. That don't matter to me whatsoever. But that's not the case for everybody. Everybody, you can't just say any or everything about, and they're gonna just take it lightly because some people got nothing to lose. Nothing to lose. And it's crazy because Raji Black, or however you pronounce his name, had everything to lose. Everything. His career, his livelihood, his children, his life, and he lost all of that in a couple moments. In a couple moments, he lost all of that because people want to play. Now, again, we don't know if those accusations that was made about him, if they were true or not. We don't know. But for the sake of being objective, I'm going by the data and the I'm not gonna call it evidence because there was no real evidence, but I'm going by the data that has been presented, and we don't know. What I do know though, and the evidence that has been filed that is public record, is that he was filing domestic violence charges against his wife, and his wife was filing domestic charges against him. That I do know, and they kept doing it. It was like a cycle. It was like a cycle of dysfunction. And that's what I'm saying. It's once you continue and you work in this within this cycle of dysfunction, bro. I really feel like you become addicted to the dumb shit after a while. I really do. This is what, like, I know I'm finna sound like a broken record. This is why I don't be hanging with niggas, bruh. I don't do it. I don't be out here in these streets. I don't got time for that, man. I don't do it, bro. Listen, I do not do it. And fellas, especially to all my professional men out there, y'all have got to be careful the type of women you bring into your life, bro. You've got to be careful. And I know people can flip on you and all that kind of stuff, but still, you have to do a better job of vetting the type of people you bring into your world, bro. I swear to God. You got to. You got to. You have to do it, bro. I'm trying to tell you. If you don't do it, fam, I can't do it, bro. I can't do it. I can't do it. I don't see how y'all can sit up around negative energy all fucking day. Shit is crazy to me, dog. Like I don't get it. I don't get it, bro. I will be in the house by myself before I be around all that bad energy every day. I got to deal with that stuff in the world. I deal with it in the world on the streets every day. Y'all fooling. But some people thrive off that. And that's what I didn't understand about that situation. First of all, we talking about domestic violence, bro. And I'm talking about Raji Black in this whole situation, right? He was filing domestic violence charges against his ex-wife, and his ex-wife was doing the same thing. Fam, don't you realize that? Because his ex-wife was a CRNA too. His ex-wife was a CRNA. Don't y'all realize y'all can lose y'all license over that shit, bro? Like, this is why I'm not gonna say it's totally on because people, I believe some people took it as, oh, we were defending him. No. We were just trying to properly assess the situation. Evidence-based practice. You dig what I'm saying? Y'all know what that is. Evidence-based practice. There you go. You did. We were trying to properly assess it. Bellamami says, CJ, I just booked our cruise for January 2022 to debrief from our jobs. I am a DNP and my husband's a fireman, and now we're looking forward to vacations monthly. Thanks, bro. Great advice. See? There you go. And listen, Bellamami, make sure you go over to the Traveling Heartbeats. And we do this every day. And I need to interview you. I need to interview you too. I would love to interview you. Hey, Bellamami, listen, do me a favor. I'm about to put my email in the chat. I'm about to put my email in the chat. I'm about to put my email in the chat. Please send me an email. I would love to have you on the show, and we can talk about some of the things that you've experienced as a DNP. Please put your please email me, shoot me an email, and we'll chop it up. But I'm glad you're going on a cruise. Go over to the Traveling Heartbeats real quick, and we trying to do that once a month. Maybe we'll holler at y'all on one of these cruises. You did. But yeah. But shout out to Bellamami and her husband, the fireman. Both of y'all saving lives. I dig that. Shout out to y'all. But like I was saying, y'all, seriously. Don't you realize, like, I don't know if he realized it or not, and I would love to know more about his background. I wonder if he was American or not. I wonder what it's just a lot of things that I wonder about this whole situation, because I don't think his ex-wife was black. I don't think his ex-girlfriend was black. Not that that means anything, but it's just been crazy, bro. But I do have a couple articles. But the whole point of me talking about that was, you have to be careful with who you bring in your circle, point blank, period. And then another important factor: why would this man get into a situation with another woman, going through the BS that he's going through? Why would you want to involve somebody else in that mess? Because if you are in a relationship with somebody that's going through that, you're in it as well. You are in it as well. And you have not fully healed nor recovered nor handled your business as a man first. That is more important than laying up with some other chick. And I get people need, people want camaraderie and companionship and all that type of stuff. But bump that. Nigga, you should have been doing, you could have got a pen pal. He could have got something else. You don't need to be bringing no other woman into this nonsense, into this world of dysfunction and chaos. And then on top of that, you get her pregnant. So you finna bring an innocent life into this, to this dysfunction in the center of it. Now I'm saying dude was fighting to get his kids, bruh. And if what he's saying is true, if what he said was true, saying that he was I'm trying not to say the word, but saying that he was inappropriately touching his own children in a horrible way, that's enough to make any sane man snap. I get that. I feel him on that part. I feel it's so many dudes fighting in the court system just to see their kids, bruh. Huh? I'm just saying, man, like I'm trying to figure that out. Like I don't get that. I don't get that one bit. But anyway, you need to heal, bro. He should have healed. He should have made sure his stuff was tight in one area so he could have properly moved on. And now they're saying that his ex-girlfriend, the one that was pregnant, they're saying that she was threatening to take away his kids or his child if it was his. She was threatening that. So we don't know if it was his child or not. We don't know. We don't know. We just don't know. But she was threatening that. And she knew what he was going through. She had to know. So I'm thinking that if she knew that, then she knew that was probably a sensitive situation for him. Now, again, to be fair, we don't know what kind of man he was. We don't know. There is a chance that this man could have been a horrible person. Just to be objective and fair. There is a chance that this man could have been a horrible person. Right? It's a chance. So I want to be fair and object. There is a chance. But at that moment, I feel like when he was talking on the live, I feel like a lot of men who are fighting in these court systems to see their children, I feel like a lot of men could relate to that. I had men on the panel yesterday who could relate to that, who could understand the pain, not what he did afterwards, not co-signing what he did afterwards, but the pain that was projected through the Facebook message, through the Facebook video, right? A lot of men felt him on that because there are a lot of men in the court system, tied up in the court system, trying to see their kids, trying to see their children. I had somebody comment on the video last night that they was involved in the court system for 10 years, trying to see their children, trying to have split custody of their children. What is somebody supposed to do? People say, well, fight harder. Well, how hard can you fight when you're giving everything you have? And that's not to say that you should stop fighting. You continue to fight to get your children. But these are the reasons that people snap. Not saying that you should. Not saying that what he did was justified. But these are the reasons that people snap. Too much going on. Some people feel they're doing the right thing by the book, and that's just not good enough. This is why people snap. But I think I do hold him responsible for what he did. I think what he did was very cowardly. I think that was very cowardly. I don't think he should have took it to that extreme, especially killing somebody that's carrying your unborn child, because now his children that are here, they're orphans now. They are orphans now. They have no mom, no dad at all. So all that fighting that you was doing, it's now in vain. It was all for nothing. So I don't agree with what he did at all. I don't agree with what he did. But let's get into the real meat and potatoes of the video. Let's get into the real topic. I wanted to talk about nurses and seeking therapy on a regular basis. Now I'm going to share an article. I'm going to share an article with the people that's watching right now. Give me a second. Let me get my StreamYard popping. Get it together. Let me get it together real quick. This article comes from nurse.org. Nurse.org, okay? All right. It says 4 reasons. Hold on, I'm gonna start from the top. It says 4 reasons why nurses need mental health days. Listen, I was on a panel with Mr. Rodney yesterday. Mr. Rodney said he's been working 3-4 years straight with no job, with no days off, bro. Every day, no days off, bro. Salute to you, Rodney. Salute to you, but that is dangerous, fam. That is absolutely dangerous. This is not a McDonald's job. This is not Walmart job. This is not you dealing with people and you have to be right every day, fam. Every day. And I get it. I'm a 60-hour dude. I get it. But every day, that's not good. Companies shouldn't even allow. I don't know if you work for the same company or not. You know what I'm saying? I understand you a man, you do what's best for you, but fam, bro, that is not good, guy. You dig? So, but yeah, this article states 4 reasons why nurses need mental health days. Oh, okay. It says the occupational stress associated with the nursing profession is a problem. Hold on, let me make this bigger. Let me see. The occupational stress associated with the nursing profession is a problem. More nurses experiencing depression and anxiety caused by their jobs, according to the Robert Wood Johnson Foundation Interdisciplinary Nursing Quality Research Initiative. Damn, that's a long title. Nurses experience clinical depression at twice the rate of the general public. You think? Shoot. Anyway, let's continue. Okay. Nursing and mental health. Nursing is difficult. It is fast-paced and requires tremendous amounts of focus, energy, and responsibility, making nurses more prone to depression. The infamous culture of survival amongst the nursing profession is intimidating. Working short-staffed, pulling long hours, being verbally and physically abused by patients, and hearing the whistles and bells of call lights. My God, they ain't lying on that. Of call lights and machines for 8 to 16 hours can weigh heavily on even the strongest and most experienced nurse. Let me tell you something about them call lights, bro. Let me tell you something about them call lights. Them call lights are from Satan. I'm going to keep it a stack. Them call lights are from Satan. They're needed, though. I mean, they're needed, but dang. They from Satan, bro. From Satan. And hearing that over and over again. Beep, 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 beep. Imagine hearing that all day for 12 hours. Beep, beep, beep. All day for 12 hours. Now, me, I've learned how to not tune it out because I answer lights and everything like that. But I've learned how to, I know how to cope with it. It don't bother me as much. You know, being in the game 2 years, you tend to do that. But beep, beep, beep. That's why I don't see how people live with them smoke alarms that go beep every 2 minutes. That would drive me crazy. But yeah, that's, man. I hear them alarms in my sleep. In my sleep. I hear call lights in my sleep. Beep. Beep. CJ. Somebody calling your name every 5 minutes. But it's a part of the gig. I chose this life. But still, hearing that all day, bro, that will drive you nuts. If you let it. Let me see. Nurses often feel they are always under pressure, making the work environment tense. A depressed nurse may find it more difficult to concentrate, communicate, manage time, and critically think. All of these factors are detriments to mental health. They can cause a delay in patient care, medication error. Yes, they can. Lapse in nursing judgment. Many nurses also struggle with anxiety. Remember, starting your first IV as a new grad? Ever had to float to a unit that you haven't worked in a while? Or maybe even never? Have you had to perform a skill that you were not 100% confident you could achieve? Were you nervous? Anxious even? Maybe nurses, even veteran nurses, still get anxious at the thought of communicating with a physician or family member. Now, I know a lot of people get nervous talking to doctors and physicians, right? I've never had that problem because, one, you're not going to talk to me crazy. I don't care what your title is. I can always go find a new job. But I've never had an issue with a doctor talking to me crazy. I know some doctors go off on some nurses, calling them stupid, calling them dumb, and all that kind of stuff. You're not going to do that to me. I'll just hang up on you. And you can do that to somebody else, or we can find somebody else to pass the buck to. Family members can become quite reckless at the mouth. Again, I don't deal with that. You're not going to talk to me crazy. I'm going to talk to you like an adult. We're going to talk to each other like adults. So, yeah, I don't deal with. But yeah, no, I just don't. I can't deal with it. Let's see. Let's see, where was I at? Oh, here it is. Anxiety can cause feelings of nervousness, restlessness, fatigue, difficulty, concentration, and of course, panic attacks. I've seen LPNs in the nursing home straight up have panic attacks and like scream and go crazy. I've seen that before. I've 100% seen that before. 100. And that's wild, bro. I just can't imagine working a job and it's literally driving me to the brink of insanity, bro. I can't imagine that. Like, that's wild to me. You know? That is absolutely wild to me. I can't even. It says feeling the weight of the world or his on her shoulders. From management, physicians, family members can easily place any nurse under an insane amount of pressure during these intense situations. Don't talk to me crazy. I'm an adult just like you. We all going through a stressful time. But let's handle this like adults, and we can all do our job properly and safely. And that's another thing too. A lot of these nurses don't have no backbone. Don't have no backbone. And management know who they can talk to crazy and know who they can't talk to crazy. That's a fact. I work with a nurse right now who is terrified of management. Terrified of this one person. And they ask me all the time, how can you do it? How can you stand? She don't bother me. Don't bother me. I'm not worried about her. All I gotta do is do my job. And if I need help or clarification with something, I'm going to ask her or whoever is in charge. Once I get clarified, or if I make a mistake or something like that, we talk about it and that's it. What's she gonna do? Beat your ass? I'm talking about terrified of this one lady, man. That's crazy. I said, this is y'all doing too much for me, bro. That's crazy. If I'm doing my job, it's not gonna get my license. They can tell on me all they want, but I'm doing my job. Ain't nobody finna talk to me or disrespect me. Nobody's finna talk to me crazy or disrespect me crazy. You know? All you have to do, if you do your job and you doing it well, and you being professional, and you doing everything in the scope of your practice, somebody just bullying you, no, it's not gonna happen. Not with me anyway. It's not gonna happen. So let's continue this article. Feeling the weight. I read that part. We all need a break, no matter how much you love your job. Yes, you do need a break. Once a month for me, baby. Now we doing twice a month, actually. I need 2 cruises a month. No matter how much you love your job, how well you perform, how much of a difference you feel you are making, we all need a break and take some time for our mental health. You are not at 100%. You cannot adequately care for your patients. Self-care is equally as important as being compliant with your blood pressure medication or insulin. That's a whole fact. So when should you take a mental health day? When you feel like it. When you feel like it. When you feel like it. If it's too much, then call off. You got to worry about you. When you feel like it. Simple as that. Now it says 4 reasons to take a break. Distraction. When you're distracted, whether work related or not, you should not promptly tackle the situation. It's easy to be at work, yet have your focus elsewhere. Taking a day or two away from the stresses of your job can be helpful in regaining control of your well-being. That's why I say, man, especially if you're in this industry, bro, you're in this field, you can't afford to be around negative people and negative situations. You'll carry that stuff to work with you. You'll carry that stuff to work with you, and you can't afford it. You can't afford it. You got to be on point all the time. You got to be on point all the time, bro. Or sis. Another reason is they say to take a break is neglect. Like batteries, we need to be recharged. Our minds and bodies often need boost of energy. If you have been neglecting yourself, use a mental health day for some self-care. Go to the spa, get that massage you've been delaying. Shop, visit the family member or friend you've missed. Take this time to do something for yourself. I preach that. I preach it, and cats be like, well, CJ, you vacation too much. No, I don't. I don't vacation enough. You dig? I don't vacation enough. I know what kind of game this is. I'm like, you vacation too much. What? Says who? I don't vacation enough, bruh. So yeah. Say appointments. Just as we educate our patients, nurses need to be proactive. Take a mental health day or two to visit your physician, therapist, counselor, spiritual leader, etc. Taking time off to address your mental health needs is instrumental in helping you function at your best. I would also say go. Oh, well, they about to put that. But I would say, definitely start working out, man. I feel a lot. Even if you just working out at home, if you walking 45 minutes, doing like a walk away to pounds, something like that, I feel so much better after a workout. I really do. And I'm not just saying it just to say it. Like, I really do feel better. Anxiety, uncontrollable behavior gets your license reported. Yeah, it will. Yeah, absolutely. Okay. And then they say physical health. The World Health Organization, who states there is no health without mental health. Poor mental health is a risk factor for chronic physical ailments. When your mental health begins to affect your physical health, you should definitely use a mental health day to care for yourself. Neglecting your mental health can lead to serious health complications such as heart disease, high blood pressure, a weakened immune system, asthma, obesity, fat ass boy, fat ass girl. Gotta do something about that. Gastronomical problems, premature death. We've all heard the adage, pressure makes diamonds. This is not the case when it comes to the mental health of nurses. It has become expected that a nurse should work well under pressure. This is irrational and not safe in expectation. Taking a mental health day can be beneficial in reducing some of the occupational hazards nurses face daily. I firmly believe if we save nurses, we will save healthcare. I'm going to push back on that, the last part, a little bit. I believe pressure does make diamonds. You are trained to work in pressure, high pressure situations. Listen, doing a code, when somebody codes, that is a pressure situation. You are trained what to do in situations like that, and it makes you a better nurse, in my opinion. I think a lot of nurses do work extremely well under pressure, but that's not to say when you constantly on call all the time and everything like that, that's different. You know, when you constantly working and putting yourself under unnecessary pressure, there is such a thing as unnecessary pressure. But I do believe some pressure is good for you. I believe it will, and it does in some cases make you a better nurse. Nurses are athletes, man. They are athletes. I don't know how else to put it, but I really feel like nurses are athletes. Um. So yeah, that's how I feel about that. I mean, I think you definitely should take mental health days. I think you definitely should take your vacations. I'm doing because I said, you know what, I need one twice a month. I need one twice a month. I need a 7-day vacation and a 3-day one. Just up out of here in a different setting somewhere. Twice a month. I ain't got time. I'm not gonna be killing myself over nothing crazy like that. I don't got time to be dealing with this madness all day, every day. It's madness right now. Madness, working short. Everybody complaining. People dying left and right. People cold all day. That's what people did. That's what nurses deal with. Gotta worry about if they gonna cold or not. That's why a lot of nurses are drug addicts. It's real talk. That's why a lot of nurses are drug addicts. You'd be surprised how many drug addicts that are nurses, man. They got easy access to drugs. You know what I'm saying? Make a lot of money so they can afford to buy them if they need to. You will be surprised of how many nurses are actual drug addicts. I've seen it. Mm-hmm. Yeah. That's why I say I try to live a stress-free life, bro. I don't need nobody around me that ain't trying to get to the bag and all that kind of stuff. Ellie says, our job is designed to take pressure, but not all the time. I agree with you. Yeah. Sometimes we put ourselves under unnecessary pressure, but this is a pressure-based job. That's the whole point. They wouldn't be paying you like they do if it wasn't. That is the whole point. So, ladies and gentlemen, I ain't planning to be up here too long. I just wanted to, give my insight on some things for today. I am about to get ready to study, get ready for this last quiz. I got to catch up on a little bit of homework. And yeah, that's pretty much it, boys and girls. So until next time, I bid you adieu. Thank you for watching.